My name is Kareen Ulysse. I go by Kareen Ulysse. I am the founder of the Centre Hospitalier de Fontaine Foundation, or the CHF Foundation. So a little bit about myself before I get into the foundation. The first 14 years of my life were spent in Haiti. The first 7 of those 14 years were spent in Cité-Soleil. And I'll attach a clip where you can see the shells of my very first home from one of the windows where the volunteer dormitory. And in those 7 years, I have to say that I've been very grateful to have been blessed with my parents. My mom never discriminated against people because of their socioeconomic status. I was able to play with the people around the neighborhood. Even when I go to the hospital now, 70% of our staff is from the area. So they call me JJ, which is what I grew up being called. They're like, JJ, look at you. So they're pretty happy to see me. Yeah, I'm very grateful that my parents didn't instill this superiority complex in me and my siblings, which is very common in Haiti. So because I was able to play with everyone from a very young age, and I was always an introvert, I always processed everything a little differently. I noticed early on that there were differences between myself, and yes, I was able to play with the children, but then I knew very early on that there was once we went back home, our home life was very different, and that never really sat well with me. I remember I was little, driving to school, and there was this little girl. I can't remember if it was a little girl or boy, but I remember seeing, my mom was dropping me off, and I remember seeing this girl on a pile of trash, and I was asking her, well, why am I going to school and she can't go to school? And I can't afford to send her to school. And I remember saying something to the effects of, well, why can't we just take her to school with us? And then it just didn't make sense to me that I got to do certain things that other children didn't do. So that's always been me. This is not a philanthropy. Is the foundation added the structure, gave me the foundation gave me the structure, but this is not something I'm doing for a job. This is not something I'm doing for clout. This is not something I'm doing to go viral or famous. It's just who I am because of the person that my parents made sure that I became. Always be respectful of people regardless of who you are. My dad always tells me, don't get comfortable even with where we are now. The decks are always being reshuffled, so just make sure that you're always a kind person, always a compassionate, not a blind fool. Doesn't mean that you're a fool and blind. I'm always working on my wisdom and discernment and emotional intelligence, but always be kind and remember that anything can happen at any moment. I have to start by saying there would be no foundation without my father, without the hospital. So in the mid 1980s, he was one of many young Haitians who went into seminary school to become a priest, because at the time the Catholic Church was very involved in community development programs. He was assigned to Cité-Soleil, him and about 3 or 4 other friends also studying to become nuns and priests. Their job was to launch an agricultural development program so that the farmers can, grow their own food, teach them how to grow their food, take care of it, sell it, and all that stuff. During his internship, I'm going to call it internship period. So during his internship period, he noticed that there was no access to medical care for the farmers when they would get hurt. So him and the 3-4 other friends, or 5 other friends, they put money together and they built like a 2-3 bedroom clinic that just offered primary basic first aid care. They would find nurses to volunteer. Between them, they would put money together to be able to pay some nurses and some doctors to come a few days a week. Unfortunately, by early 90s, 92, politically the country started to, the downward spiral of the country started then. Cité-Soleil, I should say, was always a poor area, but it wasn't dangerous because people could go to work. They weren't earning more. It was just a low-income area. But as the jobs started to, you had sugar manufacturing companies, sugar cane processing and sugar manufacturing companies that were there. They all started to shut down. And of course, as the quality of life of people started to decrease, then the rate of violence started to increase, which is why we ended up leaving in the late 1990s. So His friends at the time, as things became more dangerous, they kind of sort of asked to be removed from their posts, and they kind of they walked away. They had to walk away from the clinic. My dad, him being himself, he was, I can't. I already see the need. I think they were like 2 or 3 years in. I already see the need, and I'm not going to walk away from it. So he had to walk away from seminary school because his father passed and there wasn't enough money for him to support himself and his 10 other brothers and sisters. So he committed himself to keep the clinic going by himself, and he became an engineer. A good chunk of the roads in Port-au-Prince were built by him, and he would reinvest 40% of his profit into the hospital. So little by little, and by himself, because the Cité-Soleil, no one helped. There were no government assistance. There were no business owners. There was no one waiting in line to help Cité-Soleil. On a scale of 1 to 8, for some context, with Section 8 being the best possible quality of life someone could get, and we know what Section 8 housing is. Cité-Soleil, where we are, is like a Section 1 community. So he knew that if he walked away from that project, then a lot of people would suffer from it. So he reinvested again up to 40% of his profit for 31 years, practically by himself, to get the hospital to where it is today. So there would be no foundation without my father in starting this work. Where do I come in? So, and I say this to say, I tell people I'm the new face. So when I'm asking for donations, when I'm asking for support, it's not, I know what I'm doing because I have 31 years of experience to leverage. This man is 62 years old. He's been in politics for 30 and some change years. He's backed away now, but he knows what he's doing. He knows what he's talking about. This is his baby. He practically held the hospital, has kept the hospital open, and the community open by itself, because the hospital is the primary employer for the area, a healthcare employer for the area. 70% of our staff is from Cité-Soleil. So we make sure that the community feels involved, and feels represented in what he does. So this is why we're there. Where I come in, it's really started in 2017. So I always knew that we had the hospital, but I knew it wasn't Cité-Soleil. Listening to other people, I wanted nothing to do with it. And knowing what I knew about Cité-Soleil, I didn't pay attention to it until 2017. My dad's mom, got sick, and she was admitted at the hospital. While I was with her, visiting her that day, one of our staff members, he's been there since the very first, Mr. Lucien, and he came. He was like, you don't come here often. Would you like to tour the hospital? And I was like, okay, sure, I'll tour the hospital. And that was the best yes of my life. It woke me up how much work he had done to get the hospital to where it is today by himself. And that tour opened my eyes also to how much further he had to go. So during that tour, I don't have a medical background. I'm a teacher. My training is in teaching. But by watching CSI, Law and Order, and things like that, throughout the tour, when we went to the laboratory, that's when I said, okay, something is off. I don't know, I'm not a trained medical professional. I'm not a lab technician, but I knew some things were off because I knew the lab is supposed to be a sterile space. The patient samples shouldn't be exposed to light and dust, and Haiti is a very dusty place. So I was like, okay, this is not right. So I'm taking note. I first backtrack. I took note of everything that was going right, because to have been there by himself for 26 years, he knew what he was doing, and he was doing the right thing. So that trip helped me see that, okay, now I need to improve what is already here, which is where the mission of the foundation comes in, which is to improve the quality of healthcare and education accessible to low-income, marginalized, underserved, underdeveloped Haitian communities through a strong network of partners. I was like, okay, he needs help. I'm gonna start with the lab. I toured the whole hospital. And I'm like, okay, if I do nothing else, let me at least improve the conditions of the lab, to make sure that, Because if you mess up the patient samples, then you get the wrong diagnosis, then you get the wrong treatment course, and then instead of making the situation better, you're exacerbating the patient's condition. So that's how it really all started. It's just that first tour, walking around, looking at the lab and saying, whoa, this isn't right. What can I do? So I called a few family friends. I said, do you know anyone who can serve as a consultant for the foundation? I mean, there wasn't a foundation at the time. For the lab, this is what this is. I sent some pictures, and sure enough, I did find this young lady. She's Haitian. She works for the government in the laboratory as well. And she said, whoa, yeah, you're right. You need XYZ space and move it to a place where you completely eliminate sunlight. It needs to be a temperature controlled room. You need a fridge. You need to make sure the staff has XYZ. So she served as a virtual consultant, and bless my dad's heart, I said, Papi, this is what the lady says we need to do. How much do you think it's gonna cost? And then he said XYZ. So I just started calling my friends and say, hey, I'm trying to do this, I'm trying to do that. This is a budget. Can you help? And bless their heart, $20 here, $30 there, $10 here, $50 there, $100 there. I wasn't even able to raise like 30% of the funds, but I was able to show my dad, like, okay, people are listening. They want you to be okay. They understand what's going on. And this is my contribution. And him being him, he dipped into his own pockets, and then he changed the lab. So that was that. That was the very first, that's how it all started, that 2017 trip, noticing the lab and realizing that I had to do something for the lab. 2018, a year and some change later, my grandma, my dad's mom's condition worsened to the point where she needed respiratory assistance. And we ran out of oxygen at the hospital. So, and it was during one of the shutdowns, the nationwide shutdowns, and we couldn't get her. We ran out of oxygen, and because Cité-Soleil, the way it is, it's always the very first place that's denied access to everything. No one was willing to deliver oxygen to us, and we didn't have an ambulance at the time, and we couldn't send her to a hospital that did have oxygen. And unfortunately, while waiting for a hospital with an ambulance to come get her, she ended up practically choking to death from an asthma attack because we ran out of oxygen. And her passing in 2018 because of the lack of resources was really my wake-up call, like, okay, this is definitely as far as my dad could have gotten on his own. And if I don't step in now, the hospital may very well shut down in the near future, because I did notice during that time that, he is slowing down, his hair is getting grayer. He's getting, he was not discouraged, but that the same fire that he had, after fighting for something for 28 years and watching your mother die because you didn't have the resources that you needed at your own hospital, I could see the fire in him dimming. So her passing was my wake-up call, like, okay, I have to really be invested in this. I have to fully be involved and help him pick up where he left off and improve again what was already here. So 2018, that's really how I committed to this work. I didn't quite know what that would look like, what it would be. Just like the lab, it was more of, okay, what do you need and how can I get that for you? Coming to Haiti, listening, paying attention, writing down the needs, going back to the States, and then, contacting friends and people, etc. So from 2018 to 2020, that's all I did, just back and forth to Haiti on a quarterly basis, and go back with the needs and come back with the resources. Go back with the needs, come back to Haiti with the resources. 2020, the amount of support, it wasn't much, I'll be completely honest. So I was like, okay, well, I'm getting to the point where I'm raising, $5,000 for the year. I really need to make this official, because the social political situation in Haiti was getting worse. The needs were getting greater. And again, because we're in Cité-Soleil, no one was standing in line. There's no one really standing in line to help the people, the communities where we work. So I needed to create a formal structure. So in 2020, after getting 2 years of hands-on experience of still trying to figure out my place in this whole situation and what it is that we do, in 2020, I decided to officially register the foundation with the IRS. And it was important to me to name the foundation after the hospital because I did want to show my father that I'm not ashamed of his work. I'm not ashamed that we are in Cité-Soleil. A lot of people tried to discourage me, telling me not to work here, you're wasting your time, etc. But it was important to me to name the foundation after my father's hospital. So people know, no, I'm committed to the neighborhoods, to the people that people ignore. The people that I, now looking back, that I played with, and some of them were our employees, whether they're old or my age, who still call me J. I wanted them to know that this hospital is going to be okay and that I'm here now. So that's really how it all started, which is my grandmother getting sick that day, saying yes to the tour, committing to doing something for the lab, and after her passing, seeing what the needs were and coming back. So for the foundation, it started off as a financial support system for the hospital. See what the needs are and come back. And that year, 2020 to 2021, that's practically all that we did. And then came the August 14th, 2021 earthquake. And that was my opportunity to venture out of the immediate financial support aspect of the foundation. Again, still, I'm telling you, this is happening in real time. Like, right, today is October 25th, and I'm in Haiti now. Fuel is still sold on the black market, and Haiti has never been in this position before. So I'm still structuring the meat of the foundation to be able to function through Haiti's worst hours, darkest hours. And if this were to happen again, just like COVID, right? There was no COVID protocol, no pandemic protocol until COVID happened. And I don't believe there's a foundation right now that really knows how to function during Haiti's darkest hours. So I'm asking for people to be patient with me. I know what the foundation does. I'll get to the meat of it, but the how still looks different because the situation is degenerating every day and the government is doing nothing. So 2021, when the earthquake happened, August 14, 2021, that was my opportunity to say, okay, well, the foundation also needs to be involved into immediate disaster relief, because I remember feeling so helpless in 2010. We lost my dad in 2010 too. He was under the rubbles during the earthquake. And I remember feeling so helpless as a young woman, a 20-year-old in college, that these big organizations, some by former presidents and some by whoever, the money didn't go where it was supposed to go. And now you have a whole bunch of people in 2010 who lost their homes, and now they're the ones who created the new ghettos, and then their children growing up in these types of conditions are the ones that are causing the problems on the street. I could see what's happening now coming. I could see it coming, and I felt helpless, and I knew then that 2021 Earth, in addition to being a financial support system vehicle for the hospital, it had to become something. It had to be involved in disaster relief, humanitarian relief for Haitians by Haitians who have been in those positions. So in 2021, I added the disaster relief aspect to the foundation. So the foundation, the number one thing that I want people to know is that the foundation is one entity and the hospital is a separate entity. The foundation is this big umbrella. That's what the vision is this big umbrella of financial support where we help close the financial resource gaps, the material resource gap, the human resource gap, the intellectual resource gaps for our local partners in healthcare and education. So before venturing out to do what we're doing at the hospital now, the foundation we're creating the blueprint through my dad's hospital, and me being a former teacher, I had to add education aspect to it. So September 2021, I remember scrolling through IG and finding this young lady. She posted about fundraising for this school in Cité-Soleil, and this K-12 school in Cité-Soleil. And again, because I know no one is really in line to help Cité-Soleil, I was like, hey, can you put me in touch with that school principal? What I can do for that school. And since September 2021, the foundation now has officially the healthcare aspect that we do, and the education aspect through the healthcare through my dad's hospital, and the education through Monsieur O'Neill's school. Three things that we focus on: healthcare, education, workforce development, jobs. And the reason why I had to add jobs to the situation, like I said, when I come to Haiti, I'm paying attention to everything. I'm putting everything from my dad's head and my observations on paper. And I realized over the past 31 years, what he's done is practically create jobs. The only way the hospital has been able to survive through all of this, despite being in a gang-riddled area, ridden area, is because the community feels represented in the hospital. We hire the grandmas, we hire the uncles, we hire the moms to give them a chance at employment. So I realized that if I neglect the employment aspect of it, because a lot of foundations, you know, when I presented last time, I was like, hey, save the children, school lunch for the children, or pay the medical bills for this mom. But then after you pay for the school lunch, when the kid walks out of the safety of the school gate, nothing changes at the community level. I realized then that nothing would change, even if I did get you all to support that one kid, but nothing changes to that. So since then, the biggest thing that has happened is I added the workforce development aspect to it. We need to focus on the parents. We need to get parents back to work. We need to get young adults to work earning, so that the community changes. Yes, we're providing school lunch for the children, but also they know. We also know that we created a job for their parents and their older sisters. So the foundation, what it does is healthcare. We partner with with experienced local healthcare partners. The hospital is 31 years old. We partner with experienced local education, K-12 education partners, which is Monsieur O'Neill's school, which is a 28-year-old school. And then the workforce development aspect of things, which is I asked my father to reopen. We had a college in the early 2000s. And I said, we have to start back. We have to create a continuity pipeline where, okay, the child is sick, he comes to the hospital, or, you know, a mom is pregnant, she comes to the hospital. And again, in Cité-Soleil, right? She comes to the hospital, she gives birth, the baby is okay, and then now we have that K-12 school that we can funnel them into. And because now, before we officially partner with the school, I'm like, this is my vision. I completely respect your vision. This is my big picture vision for the foundation. Can you see yourself in complying to our vision? And then we find a common ground. So you're born at the hospital. We now have this K-12 school that we can, you know, that pipeline takes you to the K-12 school. And then once you graduate, then we have the college at the hospital that that same student or their parent can go back. One thing about that school, Monsieur O'Neil started first grade at 17. So he gives everyone, he's from Cité-Soleil, he grew up in Cité-Soleil, he saved up to send himself to school. So it was important to me to be able to create, like I said, a continuity pipeline where we can move communities out of poverty. 4 things the foundation does. Number 1 thing is we serve as a bridge for, or a conduit for between our local partners and people who genuinely want to help Haiti, impact Haiti in a meaningful way. And we create that visibility because, again, if I didn't step in, no one would know that my dad's hospital was here. If I didn't step in, no one would know that Monsieur O'Neill's 20-year-old school was there. So we serve as a bridge between our local partners and people who want to help Haiti. That's the first thing. Giving them the visibility and creating that structure so people could trust them. And I will say that whoever that the foundation partners with, they are registered and in good standing in Haiti. I had a friend, she has a school, and she wanted me to support the school when I was trying to find a school to support. And I was like, okay, great, I would love to, very good friend. And I was like, cool, send me your school's paperwork. She was like, oh, we're not registered. And I'm like, I am so sorry. I am so sorry, but I can't. Even though you've been doing this for 4 years and I know you and I love you, but I had to make sure that I start with organizations, with people who took the time to do things the right way. And a lot of time it's not their fault, because now with the country shutting down, the government offices are closed, etc. But that's just something that was important to me, to add visibility to people who have been doing it for years, where I know I'm not worrying about, do you know what you're doing? You already know what you're doing. It's just adding the structure to help improve their internal capacity, and also giving them the resources to help their vision come into play, while also making sure that their vision fits the guidelines that I'm creating for the foundation. The second thing that we do is we close the resource gaps for them, right, to improve their internal capacity. It's not just giving them the money. I give them the money that we raise, and because they've been doing this for years, I'm not here dictating what they do, but at the same time, okay, you have to, using the profit first method, we're gonna have to use a chunk of that money to go into staff training, to go into getting some technology, to go into getting things done, to improve their internal capacities, to help them improve the quality of the services that they offer. And then the next thing that the third thing that the foundation does is community program design and development. And we do that by involving and integrating the local communities. And one of the examples are with the school, for example. We want to take things to the next level with the school. I spoke with this young lady. She comes from a lower socioeconomic background. I hired her. It's all about creating jobs. I'm like, I need you to audit the school, tell me what the school needs, and then based on your personal experience, having worked your way up the financial ladder, and then understanding having been in those students' position, from your perspective, this is what I say the school needs, right? But from your perspective, what does the school need? And we sat there, we spent hours and hours and hours till we find, the three core things, the three immediate things that we can do for the school to help them. So it's program design and development by integrating the community, because again, Haiti has never been where it's been today. So it's important to involve people who not only have lived through the worst storms, but also can relate to the reality, because no matter how good of a teacher I was, no matter how good of a heart I was, I didn't grow up in those conditions. So my understanding of the pain and suffering and the disparity is from a removed position compared to someone who was in those overcrowded classrooms where they were getting beaten, where they get beaten in the classrooms, where teachers honestly believe they can beat the lesson into you. So I wanted to get someone who's been through that and can also understand my vision to help me develop a program for that school. And program design and curriculum design and development as well. And the fourth thing that we do is designing and developing revenue generating strategies for our local partners. Again, Cité-Soleil is the first place to be cut off from all aid. So I realized with my grandmother, for example, if we had oxygen, if we had our own way of making oxygen, one, she would have been alive, and then we would be able to, the hospital would be able to sell that oxygen to oxygen tanks to surrounding clinics and all that stuff. So that's income for the hospital, just in case whenever donors decide to stop for whatever reason giving, but at least there's some kind of revenue generation coming to decrease our dependence on aid. When you donate, I do want you to know that there are four main categories that people can donate to: healthcare, K-12 education, workforce development, which is a college or adult education, and also disaster humanitarian relief. These are the four categories that people can donate on. donate to. Within each category now, we work in 3 phases. There's the intervention phase, there's the rehabilitation phase, and then there's a restoration phase. And this is where most foundations, in my opinion, fail the communities where they work. One, they want to focus on one child at a time. And with the mindset, if we help one, then we did something. And I don't agree with that, because if we're going to use my dad as that example, it took him 31 years to be able to hire 111 people. So are we willing to wait another 31 years for Haiti for another one kid to be able to do something for 111 people? I think not. I don't think that's the best way. So when someone donates, I want you to know, when you donate, you're donating to support a community and the hospital, the school, and ecosystem, and everything that they represent. When I talk, I'm not gonna say, hey, help, help provide lunch for Samantha. I'm like, no. You can either help provide lunch for a whole classroom, a whole grade level, or the entire school. We need to make sure now, if we really want to see change, we need to be able to support these things in chunks. So in the intervention phase, whether it's healthcare, education, or workforce development, or humanitarian relief, in the intervention phase is the immediate needs, helping relieve the financial needs of our partners for a chunk of their either students or patients at a time. So when you donate, 50% goes into the intervention phase, which is the now, which is what you're seeing me post on Instagram, in what you're most likely going to be seeing on the website for a long time. It's the operational right now. What do you need to keep your doors open? And then the next 50% goes into the foundation itself, which goes into the now we're getting into the long-term phase 2 and phase 3, which is the program development, design and development, curriculum design and development, revenue generating strategies, design, development, testing, and launching for all 3. So 50% now goes into the long-term plan to how do we now make sure that we move this community out of the mental shackles that it is in, and how do we move the hospital and how to reduce the hospitals and the schools' dependence on aid. I understand how to maximize every cent you donate. I've done everything I can on my end so that this foundation is everything it could be and it should be.